Hello, good afternoon. Thank you all for being here with us today. I want you all to know how much I appreciate your efforts, and I want to let you know that the discussions about our next steps in Mississippi have gone very well throughout this week. As I said yesterday, this is and continues to be a long process. We are not going to be able to flip the light switch from off to on, just like we did not flip the light switch from on to off. Whatever we do is going to be cautious and it's going to be gradual. We have to begin reopening, but we also have to do it in a way that is safe for all. Our public health team is working on a plan to help ease us back into an open economy. I hope that we can take one step next week, just as we took one step this week. I have said it before, and I will say it again. There is no such thing as a non-essential business to the owners and the people who depend on that business to provide for their families. It is essential to provide food, supplies, and shelter for every single one of its employees, and I understand that. We cannot eliminate layoffs or economic problems. People are changing behavior on their own, and that is going to continue to make it difficult for many small businesses. We can, however, do everything in our power to limit those instances where an order from the government prevents a Mississippian from providing for themselves. I have a fundamental issue with that, and we are going to get out of that situation as quickly as we can in a safe, responsible way. Testing and tracing are continuing to come along very well. You probably remember that has been our strategy with respect to this virus from the very beginning. We called it identify and isolate. And even during these times of shelter in place, we have continued to identify and isolate. We have also continued to build capacity and increase volumes on the number of individuals at the Department of Health that are working on that project. The fact is that Mississippians are doing their part to flatten the curve, and the curve is, in fact, flattening. We see more evidence of that every day. 2 weeks ago, we had 128 patients on ventilators. Today, we have less than 80. The same trend is true for patients in the ICU. This is during the period that the national experts predicted we would be at our peak resource use. Now, those numbers are so low that they will continue to fluctuate greatly. But the good news is that they are far lower than anyone originally projected. Some national experts thought we would need about 4,000 hospital beds this week. Instead, we're using less than 400. Let that sink in. That is because your efforts are having an incredible impact. Let me say that again. What you are doing as Mississippians to protect yourselves and protect your neighbors is making a difference. In our state, we're not seeing a widespread outbreak. We're fighting smaller, localized battles. It's a different challenge. Right now, we're trying to prevent a deadly localized spread in one nursing home or one church or one workplace or one other building at a time, not to prevent our entire hospital system from being overwhelmed. Why? Because of your efforts to slow the spread. Mississippians working together are beating this virus. Now, we cannot stop it entirely without a vaccine. We can slow it down, and you have slowed it down. You've beaten every projection, and you've saved countless lives. It has taken a tremendous cost. Yesterday, I had our unemployment team here to talk about the progress that we were making. It is a historic rush on our unemployment insurance system. There are many of our fellow Mississippians that are hurting. Between the historic flooding, historic tornadoes, historic pandemic, and historic surge in unemployment, there is a greater need for help in Mississippi than at any time in modern memory. If you have any ability to support your fellow Mississippians, there is a great need. I know that it can also be hard to figure out where to give funds in a way that you can be confident it will have an impact. I want to identify one this afternoon. We've designated Mississippi's official disaster fund. It's a partnership between the Mississippi Commission for Volunteer Service and the Community Foundation for Mississippi. The team there is identifying local organizations doing boots-on-the-ground work. They're getting food, medical supplies, soap, hand sanitizer, shelter, clothing, or a little money to people who desperately need it just to get by. The goal is to quickly flex resources to those places that need it most. By giving to this fund, Mississippians can know that the money will be pushed to the hardest hit areas quickly and efficiently. It will support local efforts on the ground. If you are interested in helping by donating, even a little bit, you can go to formississippi.org and click on the Response and Recovery Donate Now button. Again, it is formississippi.org, and please click on the Response and Recovery Donate Now button. I know there are many places you may choose to donate to help your fellow Mississippians. This is the one that we have identified as the state's official disaster fund, and we believe it can have a great impact. If you're willing and able, I'd strongly encourage you to consider making a donation today. If you choose another path, just know how much your fellow Mississippians appreciate you and your willingness to step up and help financially in these very desperate times for many of our fellow Mississippians. At this time, I'm going to turn it over to Dr. Dobbs and let him give you an update on COVID-19 in Mississippi.
Thank you, Governor. As a quick update, in our case count, we have 178 new cases today reported, with 10 additional deaths, bringing the total number of cases up to 4,894, with 193 deaths. The Governor reviewed the COVID ventilator and ICU counts. We do have on hand 666 available ventilators for utilization and 262 ICU beds. New information which you've seen on our website on long-term care outbreaks. We have 74 active outbreaks in long-term care settings with a total number of cases of 470. Of that 470, 163 are African American and 279 are Caucasian. We've had 62 deaths, unfortunately, associated with long-term care settings, 21 in African American community and 41 in Caucasians. Only other quick things just to mention, we're continuing to work our plan aggressively with our isolation and containment strategy. We're adding staff every day. We're up to about 200 right now. We'll continue to work that aggressively. We are expanding our outbreak response capabilities, and so you'll see more information on that as we work on that. Only last thing is, please don't let our guard down. We have flattened the curve, but we still have a lot of cases out there. We're going to have more deaths, and the better that we do individually and collectively, the more likely it is that we're going to get through this in a lot better shape. And then encourage, please, everyone, when you're out and about in public, if you're going shopping for food and stuff, we do encourage you to wear a mask. Thank you, sir.
Thank you, Dr. Dobbs. It has been a fairly regular question regarding our Mississippi Department of Corrections. I do have an update from yesterday. For inmates, we had 18 inmates test negative for COVID-19. We had 4 inmates test positive, and we had 2 pending tests still outstanding. I did hear as I was walking in that one of those 2 pending tests had come back and the inmate had tested negative. So I believe that'll be 19 negative COVID tests and 4 positive for inmates. For staff, my understanding is that we have tested 25 staff members at the Department of Corrections that have tested negative. We have tested 4 Department of Corrections staff that have tested positive. We currently have 6 pending tests of staff outstanding. And just as a note, of the 4 positive COVID tests that have come back, at least one of those employees that tested positive has since returned to work. So obviously they were tested positive, they went through their 14-day isolation period, they recovered, they were well, and now they are back at work, and I don't have a status on the other 3. So that gives you an update there. Today is Wednesday, and as we told you last week, there is a heightened risk for horrific weather tonight. As I have unfortunately had to say multiple times from this podium, just because COVID-19 is in our communities does not mean that the wind stops blowing. We are anticipating weather could get bad later tonight. The really unfortunate thing about today's potential bad weather is it's projected to come in the middle of the night. That is not ideal by any stretch of the imagination. And while I do believe that the relevant risks have been downgraded slightly over the last 24 to 48 hours, there are still elevated risk of tornadic activity, significant amounts of rain, and therefore potential for flash flooding in many places across our state. With that, I'm going to turn it over. We're happy to have Director Michelle back. As I told you yesterday, he was out in the field touring tornado damage, working with members of the Board of Supervisors and EOC coordinators in counties throughout the state. Glad to have him back today. And Director Michelle, it's all yours.
Thank you, Governor. Just to give you an update on the storm damage from the Easter storm, as well as this one most recently on the 19th. Our damage assessments continue to be ongoing. We are probably somewhere in the neighborhood of about 60% complete with damage assessments after the Easter storm. Right now, approximately 1,500 structures are affected there. We certainly anticipate that number to increase as we add counties to the declaration. The storm from this past Sunday on April the 19th, so far, we're probably 20% into the damage assessments based on where we currently are. So far, about 100 structures affected. Those numbers also will continue. I noticed in there earlier today that Marion County had not posted their numbers yet, but they were out yesterday doing damage assessments there. I want to remind everyone that are in these affected areas, if you have damages and there hasn't been anyone from our damage assessment teams to get to you yet, you can go online to Crisis Track and upload photos as well as your name and address and information that's pertinent about your damages, and that will assist our teams in locating you if you happen to be in the outlying areas of the storm path. You can find that link at our website. If you don't have access to internet, it's not an issue. We will come to you. Just be patient while we wait to get damage assessment teams out to you. Utilities, as of this morning, we still had about 1,500 people that were without power in the Easter tornado, and then from this past weekend, still had about 3,500 people without power from the April 19th storm. Let me just take this opportunity to remind you, if you do not need to be in those areas, please stay out. I noticed yesterday utility crews were on one side of the road. I had difficulty getting down the open lane because of onlookers that were there. I even felt bad about being there because utility crews would have to stop setting up poles to let me by. Please, please stay out of those areas if you don't live there and you aren't working in those areas. We had a total of 240 people that were in Red Cross temporary shelters. If you are needing shelter and do not have it, you can dial 1-800-RED-CROSS, and those individuals will direct you to hotels that have contract hotel information to get there. Red Cross has changed their engagement based on the COVID pandemic, so you may not be seeing as many people in the field as you normally would. So you can use the toll-free number. If not, my EMA personnel will be around, then we'll find you and they can help you that way directly as well. And then just finally, as the governor has already said, we do have another round of severe weather coming in, and it is going to be coming in the late hours and early morning, so just be aware, pay attention to your weather alerts, and please respond accordingly. Governor, that's all I have.
My understanding is that we had 2 EF4 tornadoes in Mississippi on Easter Sunday. Has the National Weather Service confirmed that we had an additional EF4 on Sunday the 19th?
They did. So the one that we had Sunday that came through Marion County Marion County and then into Lamar County was an EF4 tornado. So that's 3 for the year. And keep in mind, last year we had no EF4s. We've had 3 already.
At this time, I'm going to turn it over to you all who would like to ask questions, and we'll start with Scott.
I asked Dr. Dobbs about the long-term care facilities. Is that still the largest cluster areas where we're seeing infections break out? 74, is that high still, or are we on the downward trend?
That is probably our biggest impact area. It's a vulnerable population. It's folks who can't get around. They're at high risk because of age and other medical conditions. So 74 is less than we had active a few days ago. So that's better, but I certainly wouldn't say that we're not at risk for ongoing growth. And we do continue to add new facilities that need assistance. So I would say, yes, that is certainly, for our outbreaks, that's probably our main priority at this moment. Yes, sir.
Just a follow-up to that while we're on that topic. A couple of questions from one of our other folks. Are the testing standards any different for those employees in those long-term care facilities, perhaps contact that maybe wouldn't otherwise qualify someone, or is there more intense testing happening in those settings? And also an employee is saying that within one of those long-term care facilities that they don't have enough PPE, that they're reusing gowns and equipment, Lysoling things. What is being done? What's the status as far as PPE in long-term care facilities?
On the testing question, we are more aggressive in testing in long-term care settings around just people who are more than people who are just symptomatic. We're going to take a bigger role in that and try to do more extensive testing around asymptomatic contacts so that we can understand who might be shedding or sick or pre-symptomatic. So we are more aggressive in that regard because they're obviously at higher risk because they've been exposed. As far as PPE, we do send PPE to centers that have confirmed COVID cases. We do have to have some reuse. I mean, everywhere's doing that. That's kind of a common thing, but I would have that center, make sure that, I don't know if you want to say anything about that, Director Michelle.
So to Dr. Dobbs' point, I mean, we are making deliveries multiple days throughout the week. Matter of fact, we're making deliveries every day throughout the week. We regionalize it so that we can get the most efficiency out of the deliveries that we have. We do respond to the long-term care facilities, and I will tell you, they are not supplied to the number of days that we would like them to be. Right now, in a lot of cases, we're trying to keep them at a 2 to 3 day supply. Those supplies vary. The Mississippi Department of Health does a wonderful job of maintaining contact with them, and then we get that PPE out. Gowns are probably the area that we're trying to build stockage up the most. We got a very large number of KN95 masks over the week. Last week, gowns, we're still trying to bring those in. So we're working to get their stockage built up to a comfortable level, and that's just something that we're working every day.
Dr. Dobbs, as we look at reopening the economy, what satisfies you to get to that point? What do we have to be at as a state to open the economy?
Yeah, so, we're different than Louisiana. We're different than New York, right? And so some of the metrics that have been applied as far as like 2 weeks of obvious declines, I would strongly support don't apply in Mississippi. We're really flat. And as a matter of fact, this is going to sound crazy, we hope to report more cases because we're going to expand our more aggressive testing around outbreaks. So we're going to see more cases, and so that as a metric is a bad metric. The things that make sense for us are going to be hospital capacity, right? The reason we flatten the curve is to preserve access to care, and we've had, modest declines and stability in that. So I think that's a strong indicator. Looking at our influenza-like illness rate is another one, and so that stuff's looking pretty good. We're not going to be complacent, but I think a lot of indicators strongly support looking at modest, measured, thoughtful mechanisms to move toward normalcy, and the governor has been looking at these numbers extremely closely, and I have every confidence that we're going to make some good decisions.
Renee?
Dave Elliott from WLOX has a question.
Great.
Dave?
Governor, I'm curious. I know your original order extended to the 27th. This coming Monday is in flux, and I know you're considering conditions on the ground and all kinds of things, walking that tight wire between what is essential and non-essential business. Can you give us just a little hint as to what you expect to announce, perhaps even as early as Friday, in regard to a soft restart of the economy?
Yeah, well, thank you, Dave, for that question. I want you to know on my social media outlets, you have gotten some of the best reviews for the questions that you've given, that you've put forth. So congratulations on that. As we look towards the next 36 hours, maybe 48 hours, we will make final decisions on what the next step is for April the 27th. So we are looking at every single industry and every single region, and quite frankly, data from every single county across the state. And so while I can't give you a definite as to exactly what things are going to look like, here's what I would anticipate. I think that you're going to see us take the position. We certainly believe that every business, whether it's currently labeled as essential or non-essential, is certainly essential to those individuals who work there. It's certainly essential to those small business owners who employ those individuals. And so as we look at it, we have talked about the potential of a regional approach, for instance, or a county-by-county approach. And as we look at the numbers and look at the data, what we are seeing is that while one case in any county is too many, we don't have any counties in Mississippi that look anything like Orleans Parish in New Orleans. We don't have any county in Mississippi that looks anything like what's happened in New York City, or quite frankly, what's happened even in Detroit, Michigan, or in Chicago, Illinois. And so, having said that, we are also looking at industries and making decisions on those industries that can quickly get back to work and do so in a safe way. Obviously, if you are in an industry that has pretty consistent interpersonal contact with lots of different individuals coming through throughout the day, that is more complicated than an industry that has fairly large space where 6 or 8 or 10 people are 6 or 8 or 10 feet apart throughout the day. And so we're talking about those differences and those distinctions. We're also looking at things like the healthcare space. One of the reasons that I entered the order with respect to elective surgeries was to ensure that when we moved into what we believe to be a peak, what all of the prognosticators believe to be a peak, that we had adequate PPE. As we look at our PPE distributions, we look at, in talking to some of our hospital facilities that have significant amounts of PPE on hand, when we see that what we're able to buy and what's coming in through our channels, we are feeling more and more confident that because we didn't have the major peak, we had what was a plateau at a much lower level than was originally projected, that not only are we more and more confident about total number of beds, not only are we more confident about ICU beds, not only are we more confident about ventilators, we're also slowly but surely getting to become more confident about how much PPE we have statewide. So as we look at the measures that need to be in effect, and I'll tell you, we're working very, very closely with Dr. Dobbs and his entire team, we are feeling more and more confident that our PPE issues, we're not going to find ourselves in a spot where they did in North Italy, for instance, Spain, where they not only ran out of ICUs, they ran out of PPE and other things. So we're feeling more confident that we're going to get through without that being the case. As we get more confident with that, that will allow us to loosen the restrictions, first in terms of the governor's executive order with respect to elective surgeries, and then also the guidelines that have been put in effect by the Department of Health on those same procedures. And so, again, it's going to be an approach, much like I've said. If you think about the number of weeks that it took us before we decided, and by the way, there's much criticism throughout that process, but we were slower than most, intentionally so, and I would argue correctly so, in putting the shelter-in-place order in effect. Now, we took measures throughout that process which eased us into it, and what I think you will see over the next 2 to 3 to 4 weeks is measures that incrementally get us out of it. And that's what I think you can look towards.
Jessica from WMC has a question. Jessica?
Hi there. We heard from the Department of Health that the current capacity to perform, there's a current capacity to perform 564 tests a day, but right now the state is averaging about 175 tests per day. Why aren't we testing at capacity in Mississippi right now?
You're talking about the state lab specifically, I assume?
Yes,
We recently added new testing abilities, and this is the other thing too that I think is very important to understand. And this is part of the national conversation. Just because your machine can do something doesn't mean you have the testing chemicals to do that many. And so that's been our major restriction up to then. But we've added additional testing capacity. We have successfully diverted routine clinical samples primarily in the outpatient setting to the private sector so that we can focus on the things that we need to do as a public health department, which is outbreak response. And that's why at this point we're deploying our test capabilities to the outbreaks. I mean, we're still taking all comers from hospitals and stuff, and so there's going to be a little bit less demand, and that gives us an opportunity to do more innovative testing approaches.
Yeah, and I will tell you, as we push forward through this, and should there be a resurgence, which many are projecting that there will be, I don't think anybody knows. Some are projecting that most coronaviruses that have existed in the population do not fare well in very hot weather, and so there are some who are projecting the summer will be easier. I don't think anybody knows that one way or the other. There are many experts that are projecting that even if the summer is better, that there may be a resurgence in the fall, and we'll be continuing to build capacity to deal with that over the next several months. But what we as a state need to get to is that the testing that occurs in private facilities or in hospitals or other areas, that testing is actually then performed. Once it's done at the facility, it is sent to a private lab. The private lab sends the results back to that facility, and then of course the reporting goes to the Department of Health. That will free up ability and capacity for our state health lab to deal with the most serious potential outbreaks even more so they can devote their resources to the areas and to those individuals that are most vulnerable. And so obviously we've been prioritizing that. We've prioritized, for instance, people who are in the hospital, because if they're in the hospital, they have serious challenges. Obviously, they've been admitted to the hospital and other things. But we would like to be able to continue to transition while building capacity, that our state lab is more engaged and involved in proactive things like proactive testing, even in long-term care facilities where some individuals are asymptomatic. So I think that's a way in which you can catch it earlier and can hopefully over time lead to fewer deaths.
And if I can add, fortunately some of the other labs like UMC have come online, and so we have more options, and so it's a good thing. It's a fantastic thing. We have more testing options, and then the other thing the health department needs to do is our traditional role of surveillance, which we do for influenza, so that we can have basically sort of localized alerts if we see a resurgence in a community that anticipates the clinical situation of hospitalizations and deaths. Thank you.
Absolutely, and I should point out that the last time I spoke with Dr. Woodward, which was not that long ago, they had identified 3 or 4 different paths from a testing perspective, and they had already come online with path number 1, and they were expecting to come online with paths number 2 and 3 and 4 over time as they built up the capacity, and as of course the State Department verified that testing capacity. Renee?
Taylor Vance from Daily Journal has a question. Taylor?
Thank you. Governor, as you well know, since more and more people have been encouraged to work from home, more health clinics have been encouraged to use telemedicine, and more schools have practiced distance learning. This has led to more people having to rely on internet for their daily lives. And because of this has also highlighted the fact that some Mississippians who live in rural areas don't have access to quality high-speed internet. And just recently we spoke to a teacher in Pontotoc County who has to drive to a parking lot to be able to use a mobile hotspot to have a Zoom meeting with their students. And so what do you think that the state should do long-term about this to address this?
Yeah, that's a great question, Taylor. I appreciate that, and it's something that we're spending a lot of time and effort thinking about as we look at, for instance, the resources that we have received as a state from the CARES Act. We have a team that is looking at all of the potential technology upgrades that could potentially be made. As you probably are aware, we worked across the aisle a couple years ago with Commissioner Presley and other public service commissioners to pass legislation which, for instance, removes the government restrictions on our EPAs for providing those services. I have said at least 100,000 times in the last year and a half that I believe firmly that 200 years ago people in America moved around waterways, specifically rivers. 100 years ago people moved around and congregated around where the train tracks were coming in. Today's equivalent is now people are moving into and out of places based upon whether or not there is connectivity. And so I think as a state, we have to spend a great deal of time thinking about what we can do to have to ensure that connectivity is available in such a way that everyone hopefully will ultimately get access to it. We've got some resources in place now that hopefully we'll be able to utilize to make that happen. But look, what we're seeing in America today is for a lot of technology companies, what they are finding, I'm told repeatedly, a lot of technology companies that are finding that their employees, their programmers, et cetera, are actually more efficient and more productive working from home than they are when they come into the office. And so that being the case, I think one of the tasks that I have given our Restart Mississippi team, our Governor's Commission on Economic Recovery, one of the things I've asked them to think about is we need to take those items that we are doing now and really transforming our way of life in a positive way and think about how we can build on it. For instance, let's talk about distance learning. There had been significant resistance in our state over a number of years by some, not by all, but by some, to do more and more distance learning. When I think about distance learning and specifically look at the number of kids that are going online, that are doing Zoom classes or whatever the case may be, I can't help but think of the possibilities that exist for 2 kids in a small rural district that need to be taking AP Calculus and AP Chemistry, but currently are unable to do so because there's not a teacher that can teach it, or perhaps it is the superintendent doesn't feel as if they have the resources that they can go out and hire a teacher to teach that. And I'm not being critical at all. Maybe that person exists. Well, there is no reason whatsoever that we can't have one teacher that's teaching AP Calculus or is teaching AP Chemistry, and there are 3 or 4 kids in every district that could go online and take that class for an hour every single day. That's great for that one teacher. It's also great for those 2 or 3 or 4 kids in every district that maybe aren't getting those class availability right now. And it's also great for society because it equalizes what opportunities kids have to take from the best teachers out there. And I'm excited about that piece of it. We've got a lot of smart folks out looking at it and thinking about it and are going to advise us on it. While we're dealing with the immediate impacts of where we find ourselves today, we cannot be like other states and just focus on the here and now. We've got to think long-term about how can we take this absolute lemon that we have been served and turn it into lemonade over the next 30 or 40 years. Scott?
As we look past Monday and things that will be getting back to business, dental offices, hair salons, but regarding dental offices, do you still want a cautionary start with that? Do they get PPEs? Is there a problem with getting PPEs to dental offices and things like that?
Yeah, well, I mean, I think generally speaking, it's my opinion for those facilities that are not operating at full capacity now, or in some instances are not operating at all. If you're in the medical field, it is not the state's responsibility to provide PPE for eternity. If individuals are going to need PPE, they're going to need to utilize their traditional supply chains. We've stepped up and bought millions and millions and millions of dollars of PPE and other things because we knew that we were going to find ourselves potentially in a spike where that PPE wasn't going to be available. Our goal from the beginning has been and will always be that if you are a Mississippian that can get better, and you have COVID-19, and you can get better with quality care, that we ensure that every single one of those Mississippians get that quality care. And that includes PPEs for the frontline workers that are utilizing it. But that's a short-run phenomenon, and so to the extent dental offices need PPE, they need to think through how they can ascertain it and acquire it. And of course, we as a emergency operations unit during the emergency will try to backfill that. But Dr. Hobbs, you want to talk? Do y'all regulate dental offices?
We've been in close conversations with the Board of Dentistry, and certainly we have a key role in those conversations. There are a couple of challenges in dentistry. The number one is, of the 4 professions that are highest risk for getting COVID, 3 of them are in the dental office. It's a dental hygienist, then it's respiratory therapist, then it's a dental assistant, and then it's the dentist. So we have to be very cautious as we go back into that. And I also know that the dentists are waiting some get back to work guidelines from American Dental Association that have yet to be forthcoming. So, I mean, there will be opportunities for gradual, measured reintroduction of work. I think they're working hard to figure that out, and we're certainly there to help them in consultation.
Governor, you mentioned this, I believe, yesterday when you were talking about restaurants, but can you speak to this potential catch-22 that may happen in terms of the workforce when even the go-ahead is given for them to reopen? You've got so many employees who perhaps have now started drawing unemployment benefits and maybe are doing better with that money and the additional $600 than they would have at the restaurant, or maybe they've just tried to find another job in an industry that's still ongoing at a higher rate at this point than a restaurant with maybe reduced hours. Is there a concern about even the industries that you allow to come back online having the staffing to make it available and not having folks say, wait a second, I thought they were coming back?
There is a concern. We have seen this before during Hurricane Katrina. For certain individuals, there was unemployment benefits that were extended for longer periods of time than perhaps the state of Mississippi was typically accustomed to paying those benefits. And for some, they made a conscious decision to receive those benefits rather than come back to work when it was safe to do so. And so there are concerns. There's no doubt about that. But I will tell you that I believe strongly that the vast majority of Mississippians take value in producing. They take value in going to work and earning money to help pay for themselves and pay for their families. And by the way, there is great personal value in getting up and going to work and doing that every single day. And so while there are concerns and we're going to monitor it, we know that until we can get these industries back open and going, it's not going to be an issue. And so the sooner we can get that done, this is an issue that I hope to be dealing with sooner rather than later. But I think the vast majority of Mississippians will do what Mississippians do. They'll get up and they'll go to work and they'll provide for themselves and provide for their families, and they'll take great self-pride and self-worth in doing so. Renee?
Emily from AP has a question. Emily?
Hi, Governor. I actually have 2 questions. One, you may be able to answer a simple yes or no. Is it a possibility that you would extend your current stay-at-home order beyond this coming Monday? And the second question is, could you please provide a little more clarity on the timeline for restaurants reopening for dine-in services?
Yeah, so the first question, I'd love to be able to give you a yes or no answer, but that's not practical at this time. We are likely to, for instance, extend shelter in place for those individuals that are in the highest risk category of contracting the virus and ultimately passing away from it, for instance. I do not think there is a very high probability that we will extend the shelter in place in its entirety on Monday, but I do think as we look at various regions, various industries, various others, I think it's fair to say that we are going to, much like we did this week, we are going to continue to loosen restrictions from state government with respect to the shelter in place. If you look at the guidelines that the president put forth in terms of their phase one, some of the things that should be implemented in their opinion, and again, these are guidelines, they're certainly not mandates, but I think a recognition that this disease is particularly cruel to those in the older category, over the age of 65, to those who have obesity issues, hypertension, and other pre-existing conditions, and so we're looking at that. With respect to restaurants, we're actually having a lot of very good conversations surrounding that as to dine-in services and how to make that look. We haven't made any final decisions yet, but if you'll recall, again, much to the chagrin of some, I made the decision when looking at restaurants, we did not shut those down very early in this process. We allowed restaurants to open, particularly those that could keep social distancing guidelines in effect. We allowed them to serve groups of smaller than 10 people and things such as that. And so as we look at what it looks like to come out of this, I think you can look to some of those very same restrictions. What we have determined over the last several weeks, for instance, is that it is definitely advantageous and helpful for everyone who is in public to be wearing a mask. And so, we could potentially incorporate some of those guidelines into the reopening of restaurants. I do want to reiterate to everyone out there, if you're going to the grocery store this afternoon, or if you're going to Walmart and you can wear a mask, please wear a mask. It is not only for your protection. If you are someone who has COVID-19 and may not have symptoms, you may be protecting your neighbors, and that's certainly something worthwhile in doing. So, yes.
Dr. Dobbs, in the latest study, the largest study of hydroxychloroquine, showed that there was no benefit in giving that malaria drug to patients. In fact, those who were given that drug died at a higher rate than those with quality care. One, should doctors stop prescribing that drug? Two, should UMC stop their clinical trial of that drug?
There's been a lot of conversation on this, and even that single study, and I've certainly looked at it closely, is certainly not definitive, right? It's suggestion. So there are consensus opinions from like the Infectious Disease Society of America and others that the best way to do this is in the context of a clinical trial. So we want to know, is it helpful? I certainly would not say that information is definitive. We need to do randomized controlled clinical trials with large numbers of folks to make sure that it is useful, or if it's not useful, that we don't need to do it. It's the same with any other treatment, whether it's remdesivir or the plasma therapy, because there's potential downsides of that as well. So really would just encourage us to use science on our side and not follow every sort of new sort of shining, exciting sort of treatment because there could be downsides like that. It's a potential downside as demonstrated. And then we're just really fortunate in Mississippi to have the University of Mississippi being actively engaged in very many trials And so we just like to once again encourage physicians, if they think they have patients who would benefit from a clinical trial who are hospitalized or in the process of being hospitalized, I know they would be very willing to take them on as within the study subjects.
Seeing no other questions at this time, I am going to, as I have promised throughout this shelter in place, wish a few great Mississippians a happy birthday. To Graham Free and Mackenzie Holmes in Guntown, to Olivia Coral, who is turning 3, to Xander Denson, to Nori Bumpus, to Sia in Clarksdale, and Deontay Williams, and Sweet 16, happy birthday to Carson Ross. Happy birthday to twins who are teenagers today, turning 13, Bailey and Kylie Snyder. Happy birthday, Olivia Morris and Lauren Hinman, Kaylee Tennell, and Yasmin Jenkins. Happy 18th birthday to an honor student at Clinton High School, Allison McGowan. Happy birthday, Joseph Causey Jr. and Addison Scott, and Kylie Wallace, who's turning 7, and Caleb Wilson, who is turning 6. Happy birthday, Carson Hemby. Happy birthday, Nova Grace Smith, who is turning 1 today. One of Mississippi's best and brightest, a National Merit finalist, Alan Herring, is turning 18 today. Happy birthday, Alan. To Adam McDaniel and Tamara Harden, Taylor Modi, Sage Brady in Crystal Springs, Presley Ray McWilliams, Ray Fowler up in Tupelo, and to James Savarese. Happy birthday, Lauren Martin and Mariah Walden, and Will Burkard, who's turning 10, and Emery Davison, who's turning 3, Lexi Thompson, who's turning 11, Addison Lutz, who's turning 12. Happy birthday, Joseph Stanley, Weston Cox, Hayden Noel Miller, Connor Matt Manning, Jayanna Garner is turning 11, and to Aubrey DeBizer, happy birthday. And this is one that I'm not sure we have gotten yet, but to triplets who are turning 7. Happy birthday, Paxton, Mason, and Danner Smith. Happy birthday, Taylor Austin, who's turning 12. Dominic Ravino, who's sweet 16. Happy birthday to Beth Clay. Happy birthday to Vicky Lashane. Happy birthday to my friend Jeff Tate. And happy birthday to Jason Spellings. It's a great day to have a birthday under very challenging times, but I am convinced that working together, we're going to come back on the other side of this bigger and better and stronger than ever before. So thank you, Mississippians, for what y'all are doing, and God bless.